I'm Dr. Ray Lowry. I'm a senior lecturer at the University of Newcastle on Tyne. I'm also an NHS public health doctor. And my job really, public health is one of those jobs that people don't understand, but we're really backroom people who try and design systems so that the health of the population is improved. We don't deal with individual patients, we deal with populations. Well, today I want to talk to you a bit about social marketing. It's something you may or may not have heard about, but we're going to go through the principles of social marketing and some examples. Well, first of all, I want to start with just telling you about some of the success stories, because that'll really whet your appetite. If you know that it's actually been used and is working, perhaps you'll be more interested in that, the techniques. The first example I'm going to give you is some work we've done in Sunderland, in the northeast of England. And as you'll see from the slide, in the old days, before we did the intervention, not that many women gave up smoking during pregnancy, because smoking during pregnancy is very harmful both to the woman but also particularly the baby. So you'll see on the slide here that 19 women set a quit date during that year of 2001-2002, and 8 actually quit. 8 actually quit at the 4-week stage. So that was pretty much state of the art, if you like, in those days, in a deprived urban area where smoking prevalence was very high. Contrast this now with this slide here shows you the the results in Sunderland nowadays, November 2005, when the Sunderland Pregnancy Stop Smoking Service is actually highlighted Department of Health best practice in smoking cessation for pregnant smokers, top 3 beacon service, and the most cost effective. Another example that I know of personally, because I did this, was sugar-free medicines. You probably know that children who have to take a lot of medicines when they're young, they may have lung disease, they may have epilepsy, and so on and so forth. They have to take a lot of medicines, and they're often sugared. And so they get, in addition to the problem they have with their chest or their fits, they also may get dental decay. So we like to encourage them to use sugar-free medicines. And we did an intervention using social marketing, and we were able to transform, compared to a control area, transform the prescribing of sugar-free medicines to children. And you can see in this graph here, this bar chart, erythromycin 125 is one of those medicines that's prescribed very regularly. You'll see in the test areas, in all 3 of the years we looked at, far outstripped the control areas in relation to sugar-free medicine prescribing. So again, that's social marketing in action. Another one that I've been involved in, breastfeeding in Gateshead. You don't need to see the details of this graph, but what I want you to note is the upward trend of all the lines, which shows that things are improving, and the things that are recorded on the graph are, for example, breastfeeding at birth, breastfeeding on discharge, and so on and so forth. And you'll see that a dotted line here at the bottom of the graph, and that is a target that was set by the government for us, and you'll see that the lines completely outstrip the target area. So again, social marketing is responsible for these good results, and believe me, these sort of results don't happen by accident. I've talked a bit about downstream social marketing. That's social marketing with, if you like, the people who are suffering or are apparently the people who are involved closely with the issue. I've talked a bit about upstream as well. In other words, we can do social marketing further back up the chain of command or events, if you like. So this next example, looking at safety in dental anaesthesia. Many, many years ago, you may have remembered seeing headlines in the paper about a child dies having their teeth out at the dentist. This sort of headline was very common years and years ago, but you don't see that now. I don't know if you've noticed that. You don't see these headlines anymore, because as a result of the social marketing process, we were able to persuade the government, we and a number of other people, persuade the government to change the rules. Because of the insights we gained using social marketing, we realised that it was only a change of the rules that would stop it happening, rather than trying to persuade people at the grassroots level, so to speak. And in America, this is another example of upstream social marketing. You probably know that neural tube defects, spina bifida, and that sort of thing. Quite a few of those cases, a very serious congenital abnormality in children involving the spine, is often produced by a lack of folic acid in the diet during pregnancy. And one of the ways we can do that is change that is to encourage women to take folic acid during their pregnancy, but it's usually too late. By the time they discover they're pregnant, it's probably too late. Another way to do it is to put folic acid into commercial flour, and that we haven't done that in this country because there's been a political lack of will to do that. But in the United States, they've done that, and as you'll see on this slide here, in York tube defects, spina bifida, since 1998, all US wheat has been fortified. They ordered the measures after research showed that about 25% of women of childbearing age consume enough folic acid, and by 1999 they found that blood folate had increased by 50%, and spina bifida and encephaly, one of the other serious York tube defects, had declined. And if you look at the evidence today, you'll see that in America, spina bifida and York tube defects have really declined dramatically since flour was fortified with folic acid. So it's another example of upstream social marketing. And the final example is a really important one. The National Health Service is perhaps the prime example of social marketing, using information about the target audience and what people want and things like pricing and placing and promotion. The National Health Service is probably the best example of social marketing in action that we've ever had. Okay, what is social marketing? Well, it's son of marketing. You've probably all heard of marketing. The visible side of marketing we're all aware of, social advertising, but actually marketing is much more than that. And the social marketing approach, as you'll see in the slide here, the social marketing challenges the view that when a health promotion campaign fails, the defect resides in the people targeted by the campaign rather than the campaign itself. So social marketing takes this view that it's not the people who haven't responded that's the problem, it's what we've been trying to get them to do, it's us. And often, in public health, when an intervention fails to produce the desired change in knowledge, attitudes and behaviours, the assumption is that the desired outcomes are essentially intractable, or that the people are just not ready to change. In other words, it's their fault, not ours. But social marketeers look at it the other way around and say, it's not their fault, it is our fault. We're not organising things properly, and social marketing helps us to get that right. This is a list of my rule of thumb about what you do in social marketing. At the top there you'll see there's what's called a global problem. In other words, in any situation, is there a global problem? Let's think about smoking in pregnancy. The global problem is that women are smoking during pregnancy. The next line down is behavioural solutions. What is the behaviour that we would want them to do that would resolve the global problem? So in relation to smoking in pregnancy, we want them to turn up to smoking cessation services. We want them to set a quit date. We want them to quit. The third thing is, from all of that, who are the target audience? In this case, it's pregnant smokers. Then we need to gather intelligence about the target audience. That's the next in the list, intelligence, and we use focus groups and other very clever techniques. And then finally, along the bottom, the 4 Ps: product, price, place and promotion. We design an intervention which is very customer focused. We make sure that it's available at a very low cost to the people, not just monetary cost but also social cost. It's where they want it. In other words, they can access it very easily because it's local, and they hear about it, so we promote it. So in a nutshell, that's the social marketing process. If you want to have a list, and the acronym for that is GOBTIP. So GOBTIP, if you really want to be able to carry it around on a bit of paper, that's the acronym to describe the social marketing process. So if you want to become social marketeers, keep that in your mind, and you won't go wrong finding your way through. Now, at the heart of the social marketing process is the target audience, and in more detail we look who are the target audience, who are we trying to reach. They may be primary, they may be secondary. In other words, for example, when we're looking at improving breastfeeding rates, the women who have to breastfeed are the first target, but the second target might be their mothers or their partners and so on and so forth. So there may be a number of people instrumental in changing behaviour. And we look at their attitudes, that's the important thing. What does the target audience actually understand about the situation? What do they know, and so on and so forth. So at the heart of the social marketing process is this intelligence gathering with the target audience. This rather complicated graph, I don't want to get too involved in this, but you'll see that this thing called segmentation, you can divide people's, how you can describe their lives into 4 segments really. At the top of the line we have this thing called demography, or geographic information, how old they are, what sex they are, where they live and so on and so forth. below the line, you have more interesting in relation to marketing. You have behavioural and you have psychographic information. At the moment, in health promotion and in health services and in influencing behaviour, we tend to get stuck on the above the line. In other words, we know a lot about their age, sex, social class, where they live, what they do, but we don't get involved in the below the line. What makes them tick, what behaviours do they have, and so on and so forth. And you probably guessed the answer. The social marketeer works below the line here more than ever. So we're interested in why they do things and what they do. I'm very quickly going to take you through a worked example of social marketing, because you're probably thinking, well, is it just social advertising and so on and so forth? And I want to take you through in some detail, and I'm going to talk to you about the smoking and pregnancy intervention. This rather complicated table, I don't want you to get too wound up in it. But down the left-hand side here are what we call the milestones in giving up smoking, setting a quit date through to having given up for 4 weeks and it's been tested positive, so to speak. And across the top you have primary care trusts that we studied. We anonymised them, but the one that's interesting is the Sunderland one. And you'll see that the Sunderland outstrips all the other primary care trusts in any of these parameters, and that's down to social marketing. So they already at the beginning of the intervention they were outstripping the other primary care trusts. The intelligence we gathered about the women who are smoking in pregnancy is pretty devastating, actually. They feel very bad about themselves anyway. The information they have is very poor. When I say a womb with a who, what I mean is that their attitude to themselves is quite different to ours. They see themselves as being a woman with a baby attached, whereas the services see them as a baby with a woman attached. How's baby? What's baby doing now? Oh, baby's growing. And if you're trying to communicate with people from two different premises, you're just not going to work. The body language of professionals was very important. In other words, whenever they came into contact with health services, they got a very negative body language back. People didn't like smoking cessation; it was unsuccessful, and we've got to go through this with you. And they picked up this information from them and felt very disempowered. And eventually, and finally, they know what they don't want to be, and they don't want to be nagged. So all we did in the social marketing intervention was we took all the barriers and we turned them round. So at the top, you see, we had difficulty recruiting women normally, and so we invented a very user-friendly service. Poor existing information was turned into very interesting information. This health professional's lack of enthusiasm, I've called it. Using role play, we were able to change that round. And at the bottom, the no nagging, we were able to change the service into a very customer-friendly, user-friendly, no nagging service. We changed the information by inventing a magazine that they read. And the identity of the intervention was designed by the women themselves. This idea of the smoky baby, the smoke overshadowing the baby. It was all their own work. And then we used role play to enhance the body language and so on and so forth of the professionals. And you'll see in this bar chart, and again it's very complicated, the height of the bars indicates the higher the bars, it means there are more women coming through. So you've got women coming through, you've got women actually setting a quick date, and women actually giving up smoking. And you'll see, marked on the bottom here, when we did the role play, and you'll see that when we did role play, particularly in this case with midwives, all the rates shoot up, and that's how important that interaction between the punter and the professional can make to all the things we're talking about. So just to remind you then, in a nutshell, social marketing is about what's the global problem, what's the behavioural solution, who are the target audience, what's the intelligence you know about them, and then designing intervention which thinks of all the parameters, the product, the price, the place and the promotion. That's a little photograph just to remind you that you keep that image in your mind about GobTip. And that's what I've got to say. Thank you.